753 in this month marks the 10th anniversary of Tackle Kids Cancer. It's a major effort by Hackensack Meridian Health to fight pediatric cancer. Over the past decade, it has raised more than $26 million to fund life-saving research and to support families right here in New Jersey and beyond. One of the experts leading that fight is Dr. Derek Hanson. He's the director of pediatric neuro-oncology at Hackensack Meridian's Children's Cancer Institute. His work focuses on a rare and aggressive type of brain tumor found mostly in kids under the age of 4. And his early research is already showing signs of hope. Good morning, Dr. Hanson.
Morning. Thanks for having me.
Thank you for being here. Tell us about Tackle Kids Cancer.
Tackle Kids Cancer is an effort by Hackensack Meridian Health that's celebrating its 10th anniversary. It's focused on raising funds to support our pediatric cancer program here at the hospital, both up here at Hackensack as well as the Jersey Shore University Medical Center. The real focus is to raise funds to advance pediatric cancer research. Really, the only way that we're able to make advances in these rare and deadly diseases is by raising funds through philanthropy. There's money available through the government, through the National Cancer Institute, but unfortunately only just a little sliver of that budget is allocated for pediatric cancer. So it really falls on us as a community to raise those funds for our kids to make sure that they're able to receive the life-saving treatment for their diseases.
And as I've been told by many people who do scientific research and try to raise funds, it's the organizations that raise funds for the diseases that impact more people that get more funds. Am I wrong or right on that?
That's correct. And pediatric cancer really is, even though it's a rare group of diseases, it has such an impact. You think about a child, 2, 3 years old, the amount of years of life lost when you have a child that loses their life to cancer is just tremendous compared to adults. And so there's just such a huge impact, not only obviously for that child and family, but just the entire community. It's a disease that really impacts us all. And so it's so important to raise funds for pediatric cancer.
And you're talking about kids who didn't do anything. I mean, not that anyone ever does something to intentionally get cancer, but these are innocent children who didn't smoke, they didn't drink, they didn't do something damaging to themselves. They are innocent. And that's why it's so, I think, so much more sickening. And we have that natural desire as humans to take care of the younger generation to make sure that they're okay. Now, your research focuses on that rare brain tumor we mentioned briefly. It's called ETMR. What is ETMR and why is this so serious?
So ETMR is a very rare and very deadly form of brain tumor. It typically affects very young children, and it really wasn't very well understood until a few years ago. And so we had a young child here diagnosed at Hackensack with ETMR, and that really sparked a huge research effort to learn more about this tumor and find a cure and develop a better way to treat this tumor. And that's really sparked a huge movement across the pediatric oncology landscape. We now have a research lab here at Hackensack devoted to researching ETMR, finding better cures for this rare tumor. And it's spurred a national and international effort where we're now partnering with hospitals across the globe to bring a clinical trial for ETMR. We're really seeing some positive results. We're seeing kids' lives being saved. And it's really all due to being able to do this research and the funding that was made available to us through Tackle Kids Cancer. And that's why it's so important to support efforts like this, because the only way that we achieve these cures is if we can perform the research. And the only way that we can perform the research is if we have that funding and support to get behind it and help us achieve those cures.
So do we see that cancers in younger children, et cetera, because they have a faster metabolism, does it tend to spread more quickly in young children?
So most pediatric cancers do tend to be a little bit more on the aggressive side. And so obviously we're dealing with very serious life-threatening conditions. On the flip side, because these tumors are so aggressive and growing so quickly, if we get them the right treatment, they can also die very quickly. And so that's why we do have, thankfully, such good cure rates in pediatric cancers, where in some forms of cancer like leukemia, the cure rates are in the high 90% range. So that's fantastic. We made a lot of progress, but the way we made that progress is by having the research available to learn about these diseases, develop new treatments, and bring those treatments to patients. And so we've been able to achieve a tremendous amount due to research, but there's still a long way to go. There's many other types of pediatric cancers where the cure rate is unfortunately not so high, ETMR and other brain tumors being one of them. But we're really dedicated here at the hospital and with Tackle Kids Cancer to keep pushing research forward so we can find those cures.
So over the 10-year period, I mean, you've seen a lot, obviously, in terms of how that research has advanced the treatment. So talk about the advances that you've seen in that 10-year period.
Sure. We've seen a tremendous amount of progress over these past 10 years. It's really been amazing and honestly very fulfilling to be a part of that. We've made tremendous progress in brain tumors, which are one of the deadliest forms of pediatric cancer. We've seen new treatments come to light through the trials we've been able to offer here at Hackensack. In a number of different brain tumors. We have a patient here that was treated. He was a high schooler with a glioblastoma, which is one of the deadliest forms
Mm.
of pediatric cancer. It has a cure rate of about 5 to 10%. We were able to get him through treatment. He's now in college, thriving, doing well. That's just one of many success stories. I could sit here all morning and tell you about all the kids who have had tremendous results with the therapy we've been able to deliver.
Glioblastoma. There are so many very well-known people, adults as well, who've died of glioblastoma. When you hear that diagnosis, you just cringe. You know, it's like there are certain cancers that you cringe at, pancreatic cancer, et cetera. When you hear that diagnosis, you just know that the survival rate is just so low. But the fact that you're working so hard on the advancement says so much. And we know that Eli Manning has been a big part of Tackle Kids Cancer. How has his involvement helped?
Eli has been our champion through this entire decade, throughout this entire 10-year period. He was right with us at the start when we launched Tackle Kids Cancer. And he's really been, again, our champion, our spokesperson that's been out there raising awareness, doing commercials, sponsoring events, and even more touching, he comes regularly to the Children's Hospital to meet with our kids, sit with them, have a chat, and just bring a smile to their face, which is just incredibly important when you think about these kids who are unfortunately stuck in the hospital sometimes for days, even weeks on end. Being able to have Eli come and just sit with them, spend a few moments, give them a visit, give them that personalized attention means so much. So you can really see that this is a cause that's near and dear to Eli's heart, and he just throws his full effort into this. And so we're incredibly grateful to him. He's made a tremendous impact on the program, has helped us raise so much money for this important cause. We're just really thankful to have him as our champion.
Dr. Hanson, what's the website for more information or to make a donation?
So you can go to tacklekidscancer.org to visit our website. You can make a donation on that website to help support the cause. You can even set up your own fundraiser so that you and your community can help raise dollars. So certainly encourage you to get to that website, check it out, learn more about what we're doing, and help us raise funds for this important cause.
It is called Tackle Kids Cancer. Dr. Derek Hanson, Director of Pediatric Neuro-Oncology at Hackensack Meridian's Children's Cancer Institute. Thank you so much for coming on this morning.
Thanks for having me.